Our research team has two recommendations related to the COVID-19 pandemic. First, the deaf community needs more education about COVID-19. And healthcare providers and government agencies need guidance on providing accessible healthcare navigation strategies for the deaf community. Historically, deaf American Sign Language users have faced barriers in three areas: receiving health information, contributing to research studies on health knowledge, and health literacy, the ability to use and apply health information. During the COVID-19 pandemic, healthcare providers and government officials shared critical information on social distancing, use of face masks, hand hygiene, and quarantine protocols to help reduce spread. Unfortunately, reliable information was not always accessible to the deaf community. Our research study was done between April and July of 2020. During that time, we conducted interviews with 175 participants. Our study found that deaf and hearing participants were equally able to identify COVID-19 symptoms. However, in contrast to hearing participants, deaf adults reported difficulty accessing and understanding reliable information on COVID-19. Deaf participants also reported using more preventative strategies. And deaf participants were more likely to seek emergency care if they suspected having symptoms of COVID-19. Again, our team emphasizes a need for education to the deaf community on COVID-19 management and guidance for the healthcare system and government officials on providing accessible healthcare information. This is important because a person who suspects they may have symptoms of COVID-19 should not seek emergency care, but should instead contact their primary care provider. Now, Dr. Tiffany Pankow, the director of the Deaf Health Lab, will share her recommendations. Public health officials should ensure that public service announcements about health information, emergency procedures, or COVID-19 should all be accessible to all audiences, and should connect with trusted agents within the deaf community to help disseminate health information online in ASL through social media channels. Figuring out the best way to navigate the healthcare system can be a challenge for anyone. But as we have seen in the deaf community, in other published studies, and now in this study, the healthcare system has more work to do in supporting deaf patients.